Hello, and thank you for taking the time to visit our poster, Audisol, Developing a Spanish Language Toolkit for Hearing Loss Self-Management. I am Dr. Naudi Ocasio-Portolatin, a bilingual audiologist and a second-year PhD student at the University of South Florida under the mentorship of Michelle Arnold. I'm really excited to be presenting our work this year at this year's convention because our work is really looking at one of the specific needs for one of the populations that is most underserved in our country, and research is showing us that is one of the fastest growing populations in the United States. It's estimated that by the year 2050, Hispanic and Latinx populations and communities in the US will surpass most and be the second largest cultural group in the United States. Now, we know from the literature that despite similar prevalence rates of hearing loss between Hispanic and Latin A adults and non-Hispanic Latin A whites, disparities persist in hearing healthcare utilization, with Hispanic and Latina adults being significantly less likely to use hearing aids overall. Now, one of the things that we see that's a barrier to access to care is limited English proficiency. We don't take this into consideration, and it could be one of those barriers to healthcare access and utilization among this community, highlighting the need for us to develop more culturally and linguistically appropriate hearing healthcare services. Now, one of the things that we intend to do with our program was the self-management of these hearing difficulties. And this is an ongoing project that was an R21 grant that was approved by the NIH NIDCD that was looking at multiple aims, where we developed a Spanish language toolkit for the self-management of hearing difficulties that was used with focus groups and marketing strategies to help decide what was the appropriate level of language that was being used, the images, and even cultural enhancements like using jargon that was specific to the region where it was developed, which was in Tampa, Florida. Additionally, what we wanted to do was take multiple questionnaires that are known in the audiology diagnostic toolkits to help us assess what were some of these difficulties. Now, one of the novel approaches that this study took is that we incorporated measurements for health literacy that have not been used in the past. One of them being the newest vital sign, and the other the self-assessment of health literacy, the short version. Both of these assessments have been well adapted in other disciplines, and they have been also developed in Spanish and have a lot of data behind them. The short assessment of health literacy is an excellent tool that allows it to be done in about 5 to 7 minutes, where the participant is presented with a series of flashcards, where the first flashcard will permit the participant to see STEM word. And based on the STEM word, we provide them with additional alternatives for them to see what is the closest word to the STEM word that's being presented. The newest vital sign is another tool that, in addition to looking at health literacy, looks at numeracy as well, which is very important when we're talking about things like dosing in pharmaceuticals and medications and other things like that. The newest vital sign actually takes advantage of using a health label found on the back of an ice cream carton, and it gives the participant some time to review the information on there. And then a series of questions are asked in terms of what they read and try to interpret what were the differences in portion size, if they had any types of allergens, if they were able to consume the product, and things like that. Both of these have never been used in audiology settings, and it's one of the novel approaches to why this study is very important. So our objective for the study was to examine the relationship between subjectively reported hearing difficulties and objectively measured hearing thresholds with participant health literacy among the Hispanic and Latinx adults. Now, data for this study was collected at the University of South Florida, as I said previously, as part of the NIH R21 grant protocol, the development and assessment of Spanish language toolkit for hearing loss self-management. Now, findings from the study ultimately will help inform the level of health literacy participants demonstrate at baseline assessment, to help us develop culturally relevant interventions to improve hearing health and health literacy within Hispanic and Latinx communities. What we hypothesize is that individuals that present with greater hearing difficulties will demonstrate lower levels of health literacy. Specifically, I'm thinking with the newest vital sign measurement, highlighting difficulties in both literacy and numeracy. Now, a little bit about our descriptive statistics. We had an N of 49. Some of our participants were lost to follow up because the second visit was a phone or a Teams visit. And there was some time in between when the study started during COVID and that we had some people that were lost to that way. But the main distribution of age, as you can see, most of our participants were kind of in the age of mid 60s to 70s. There were more females in the study than males. And then cultural background, we have an over majority of Puerto Rican descent, but we also had people from Mexican, Cuban, other Central and South American, Dominican, as well as educational levels where we started with less than a high school education and all the way up to a graduate or doctoral level education level. Now, what we saw after we did our analysis is that the mean audiogram for this group kind of teetered pretty equally amongst both ears between mild to a moderate hearing loss on both the left and the right, with the right being slightly, not clinically significantly worse than the left ear. When we look at the correlation analysis that we did on this study, we found that when we were looking at the self-assessment for health literacy versus hearing level, the points are scattered with really no clear trend indicating that there's kind of a weak correlation. So it's not a great measurement of um, health literacy overall as it pertains to hearing level. But when we look at the newest vital sign versus hearing level, there's a slight negative trend suggesting that as hearing level increases or worsens, that the NVS score tends to decrease as well, which is what we expect, indicating a potential impact on hearing on health literacy. Now, the regression models that we ran for both the newest vital sign and the self-assessment of health literacy. And the self-assessment of health literacy did not show any significant results in predicting this relationship. Now, for the newest vital sign, the regression model explained about 17.4% of the variance in the newest vital sign scores. And our key findings was that the right ear is a significant predictor with a negative relationship for it, meaning that for each increase in right ear hearing loss degree, the NVS score decreased by 2.23 points. Now, the overall model for both ears is marginally significant. Values are listed on the poster as well. Now, when it comes to our discussion, this is a secondary analysis from the primary aims from this study. I've taken a particular interest just because using other assessment tools, it's part of our interdisciplinary approach on how we want to treat patients holistically, particularly when we talk about the context of healthy aging. So, looking at this, it's very important that we start considering frameworks and research methodologies that not only take into consideration hearing healthcare, but how it's incorporated into larger models of precision medicine or precision public health, where our interventions are either going to go to the individual level or be used at a larger scale with the population as a whole. Now, the secondary analysis here is going to provide a nuanced understanding of the relationships between hearing health and health literacy within aging and Hispanic populations, highlighting the impact of some sensory difficulties on participants' capacities to access and utilize health information effectively. Um, there has to be, obviously, in our future directions, a larger population where we can continue to do this so we get more information, particularly from different cultural groups. So I think a longitudinal study at multi-site locations where we have larger Hispanic and Latinx populations might be a good way for us to increase those numbers and look at not differences at the pan-ethnic Latino level, right? But start looking at cultural group differences where we might be able to identify certain needs in terms of socio-demographic factors that may be affecting access to hearing healthcare overall. Now, like I said previously, results from this analysis will inform healthcare providers and public health practitioners about the need for integrating hearing health assessments and health literacy screenings in clinical settings, fostering a more holistic approach, right? I think it's at junction, we're at the point that as a discipline, we need to start thinking more outward than introspectively, and that we need to, as a organization, start indicating how we fit into the model of holistic medicine and healthy aging and what our contributions are to the different disciplines and how we can effectively help not only implement our intervention strategies, but other intervention strategies that we may know that may be affecting a person's ability to adequately adopt different strategies across the board from different disciplines. Um, I have attached at the bottom of the poster the references for this poster, but additionally, part of our project is actually doing dissemination of our materials. So the right-hand QR code that says Audisol Resources is going to be a QR code that's going to take you directly to our folder so you can download our resources. The resource for the oral rehabilitation program in English, it's called early age-related hearing loss intervention, and it's been used already in multiple cycles of studies going back to the Achieve study, which many know was the study that showed some indication that hearing loss interventions may decrease people that are at risk for dementia and other neurodegenerative types of disorders. And it's also been used in a couple of pilot studies that are being done at the University of South Florida. The Spanish version, which is called Audisol, Programa de Audiología y Soluciones Auditivas, is the Spanish version of this, and it's also being fielded this time around in a couple of our pilot studies at USF, but we wanted to make sure that people had access to them as well. If anybody's interested in training or more information on how to implement these oral rehab resources, we really would love for you to reach out to the Auditory Rehabilitation and Clinical Trials Lab. You can find us on the web, or you can uh, easily access me through the ASHA application platform, and we can settle a meeting that we can have some coffee and discuss the materials more openly and answer any questions that you might have. I really appreciate everybody that's taken the time to stop at our posters y espero que todos disfruten de la conferencia este año.